Hello, my name is Amy Blackman. Welcome to my presentation on military sexual trauma. I am a graduate student at Colorado State University Global in the Military and Emergency Responder Psychology program. So I have quite a few things to talk about here with military sexual trauma, and believe me, I could have probably doubled this presentation looking deeper into things such as um, base culture. Um, just believe me, there's a ton of awareness going on out there. We're going to talk about that between the branches, amongst the Department of Defense and the Veterans Administration, um, what their what their part is in responding to the prevalence, the high rates of military sexual trauma. So I do want to point out that we're going to be talking about obviously the meaning, at-risk populations, perpetrators, and survivors, prevalence, as we said, the negative impacts, some of the negative impacts. Again, that's probably a PowerPoint on its own, and then recommended treatment, which thankfully there's quite a bit. So we're going to go over that. I have a bit of a cold, so I'm sorry if I pause and I have to restart after the pause. But anyway, I do want to issue a trigger warning. Like I said, we do talk about some pretty intense things, so I just want to issue that. Just there may be some triggering information, and I want everybody to take care of themselves. So let's begin, shall we? All right, so we went over the talking points. This is who we're talking about. I really like this graphic because it includes the Space Force, which a lot of them don't. We're obviously talking about the Army, Navy. Um, oh, I put that on there. Wait, I'm get it. Oh, the Marines. My bad. I know that. Air Force, Space Force, the Coast Guard, and the Department of Defense. And then our reserves, of course. They have a whole set of unique challenges, which, again, could probably be a pretty successful PowerPoint. But anyway, we're talking about military service members, male and female. So, what is military sexual trauma? I'm not going to go through this in its entirety, but the other thing I want to point out is that this PowerPoint and all of the resources within it will be included along with this PowerPoint in a PDF form if you request. So um, keep that in mind if you want to utilize this for something else. So, you know what, actually, let's just read it through because this is the actual, from what I can tell, most recent Department of Defense definition. Intentional sexual contact characterized by the use of force, threats, intimidation, or abuse of authority, or when the victim does not or cannot consent. As used in this instruction, the term includes a broad category of sexual offenses consisting of the following specific Uniform Code of Military Justice offenses: rape, sexual assault, aggravated sexual contact, abusive sexual contact, forcible sodomy, that includes forced oral or anal sex, or attempts to commit these offenses. It's interesting when they say that it's an experience, and I think that's to differentiate it from not being a diagnosis or a mental health condition. Um, and also important to consider that survivors react in different ways. The research talks about how some are resilient, and then there's others that are resilient to a point. um, and things change. So MST can happen on or off duty, on or off base, during war or peacetime, and one or both or all, in the case of a gang situation, currently serving in the military. Survivors and perpetrators can be anyone, any gender, military personnel or civilian, superiors or subordinates in the chain of command, strangers, friends, or intimate partners. Some examples include any sexual activity against someone's will, any sexual activity when someone is unable to say no, being physically forced into sexual activities, being pressured or coerced into sexual activities, such as with threats or promises of rewards for cooperation. And that's also referred to as quid pro quo. Um, I'll give you something if you give me something first. Experience sexual contact or activities without consent, such as while being asleep or intoxicated. Being touched or grabbed in a sexual way that felt uncomfortable, including during hazing experiences. Yet another PowerPoint I could do on its own. Experiencing unwanted sexual comments or advances that felt threatening. Okay, so who is at most risk of MST? Survivors are individuals of all gender identities, sexual orientations, ages, racial and ethnic backgrounds, physical sizes and appearances, and branches or eras of military service. That, of course, insinuating age and generation. Certain marginalized groups are at increased risk for sexual harassment and or sexual assault victimization. Women identifying individuals, lesbians, gay men, bisexuals, and transgender individuals, also known as LGBTQ+. And then, of course, Black, Indigenous, and people of color, also known as BIPOC. Um, and I learned, looking through the flags and stuff, deciding which one I wanted to use. The flag represented in this slide here is including intersexed individuals. So I actually learned something. Um, I mean, of course, I learned a lot doing this presentation, but as far as um, cultural competence, I learned that that is the new flag for also representing intersexed individuals. So I thought that was pretty interesting, very inclusive. Other people at risk of MST are service members who are younger. Um, with that, generally have fewer youngers of military service. They're younger in rank, so their pay grade is lower, naturally. And, whether in or out of the military, survivors of victimization are at increased risk of additional victimization. Perpetrators. So I have a section here about perpetrators. They may actually target the marginalized groups due to sexism, racism, homophobia, classism, and I didn't add it here, but I would say ageism. Um, yeah, yeah. Now that this is pretty interesting. Their perception that members of these groups have limited power in society, making them reluctant to fight back and or disclose or report the sexual abuse. I want to talk about three specific MST perpetrators. Um, Again, kind of what I was saying, there's so much going on around MST research, not just for the survivors, but also for the perpetrators. Um, in many cases, it's going to mirror a sexual offender of any clothing, shall we say. But these three cases of MST perpetrators were particularly interesting. Um, so this fella here, U.S. Army Staff Sergeant Delmar Gibson, or Simpson, sorry, he's 32. Um, the most serious case, his was the most serious case in the Aberdeen scandal that took place at Aberdeen Proving Ground in Maryland. Um, well, I'll tell you that here in a sec. So he coerced sex from trainees, was considered around his work environments as an evil predator. Women feared that their resistance would be futile or feared injury if they resisted in some way. Um, the research also points out the ability for perpetrators to overpower their victims in a lot of different instances. So he maintained in his defense that they were falsely testifying against him to hide their own guilt because, sex in the army or the military in general, armed services, sex between ranks is not permitted. So he's saying basically the victims, the survivors, were like, you know, calling like, no, it's, um, he assaulted me instead of, saying that they were in a consensual relationship. That was his defense. And he also argued that, or his defense uh, argued that in hopes of gaining some other advantage over him or whatever the situation was. Ultimately, though, he was found guilty and convicted of 18 counts of rape, 34 counts of sexual misconduct, for which he got 25 years in prison. And then he had a further 32 years in prison for being found guilty and convicted of 11 counts of consensual sex. So that's how serious, at least the Army is about that. He got 7 more years in prison for 11 counts of consensual sex, as opposed to the 18 counts of rape and 34 counts of sexual misconduct. So, I mean, I run through that as a criminal justice person before being training to be an LPC. Um, that's just an interesting sentence, but to say the least, and if they don't run them back to back, he's not going to be out. Or if they do run it back to back, he's not going to see. He won't be a civilian again. I'll put it that way. I got all worked up. I need to calm down. All right. Our second fella is Army Staff Sergeant Angel Sanchez, 30 years old. He was accused of using his supervisory position within his brigade. He was a drill sergeant, essentially. Well, no, not essentially. He was a drill sergeant. He used his position of power to threaten a lot of the women that he was training um, after sexual assault and or abusive sexual contact. So most of the allegations involved women in Fort Leonard Wood in Missouri. Other allegations were from women in Afghanistan and Fort Richardson, Alaska. So pretty much wherever he was stationed, he was perpetrating. The females were, the survivors said that it would be in bathrooms of their barracks or this office that he shared with other drill sergeants. For that, he was found guilty and convicted of 4 counts of sexual assault, 6 counts of abusive sexual assault, and 3 counts of disobeying orders. And essentially, from the research I saw, his orders were not to have sex with fellow officers. So, with these convictions, he got 20 years in prison. U.S. Army Private First Class Christian Alvarado, 21 years old. So we had a 32, 30-year-old, and now a 21-year-old. He was accused of assaulting 5 women over a 2-year period in multiple geographical locations, ultimately charged with 7 counts of sexual assault. One woman was so intoxicated she couldn't consent to sex, so he raped her while she was unconscious. One woman was sexually, excuse me, one woman was sexually assaulted, then almost choked to death. He got convicted for that. And one woman testified that she was tackled to the ground, like during an argument. He tackled her, and then he like lifted her to her feet by her ponytail. Um, no other, like not by her shoulders or uh, torso or whatever. Like literally pulled her up by the ponytail. Also was sexually assaulted. So he was convicted, found guilty, and convicted of 2 counts of rape and 1 count of aggravated assault, and that was the choking. Um, he was also convicted of 1 count of making false official uh, statements to investigators. Obviously, when he was well, not obviously. Sorry to say that. It's prejudicial. Um, making false official statement to investigators, like every time they asked him, apparently he would just talk, continually tell falsehoods. So, just really difficult for the investigation. He got 18 years and 3 months in prison, so he'll be in there for a while. Well, as you can see here, we have a survivor here, but ultimately I had to put victim because unfortunately that's why she made this PowerPoint. U.S. Army Private First Class Asia Graham, 19 years old. She was raped while she was unconscious at Fort Bliss, Texas in December 2019 by Private First Class Alvarado, this guy. She did report it to her chain of command, which doesn't always happen. We'll talk about that later. In, let's see, February of 2020. On New Year's Eve, 1 year later, almost exactly a year later, she was found dead in her barracks. She had taken um, a drug cocktail mix of fentanyl and oddly multiple synthetic cannabinoids. We'll talk about substance abuse a little bit later, but this is obviously, in my opinion, I suppose not obviously, why I believe she was using the substances to cope with the pain of her sexual assault. Ultimately, she overdosed and accidentally killed herself. So, unfortunately, in parentheses, I did have to add victim. Same case here with U.S. Army Private First Class Mariah Alice Shirley Pouncey, 20 years old. On June, so the Alvarado story continues, I should say. Again, she's involved in the Alvarado case. I'll go back to that real quick. This guy. On June 21st, 2021, she was found unresponsive in her Fort Bliss, Texas barracks, pronounced deceased later that day. She was engaged to be married to Private First Class Graham, who was a victim of Alvarado. She was also a potential witness in the court martial of him. They didn't ultimately bring her to the stand, but it's just that's an interesting little tidbit. And this case is so weird. I keep checking to see if there's any autopsy updates about what happened with her. She's a Native American, so I pay a lot of attention to what goes on as far as deaths and murders and so on and so forth. My partner's native, so just have a special interest in that and the psychology element. Anywho, this case is really strange for a lot of reasons, but so they found her unresponsive. She died later in the hospital, but they couldn't find any reason why. And like I said, this happened in 2021. It's now 2024, and I cannot find anything that says um, that determines her cause of death. So that's frustrating. Now, this MST survivor was a survivor for a while, and um, pretty important case in U.S. military history. I would just say military, or not military, just uh, American society, frankly, of Army specialist, and unfortunately, she was named a specialist from a private first class posthumously. She had earned it; it was on the way, but unfortunately, she was murdered. Prior to that, she confided to her family and her coworkers that she was being consistently sexually harassed on the base by other soldiers in uh, at Fort Hood. On April 22nd, 2020, that was the last time anybody saw her. She was in a parking lot there on the base. Let's see, a couple months later, her body, dismembered and burned, was found in a wooded area near a river by the base or on like a distant part of the base, but I think it was actually technically off the base. But this was all over the news. I won't go too far into it, but it's really important case. This is what a military sexual um, predator essentially looks like. He's also a murderer, and the picture on the bottom is of his crime accomplice. In July 2020, after escaping from Fort Hood, Specialist Aaron Robinson shot and killed himself as he was being apprehended. Um, and it for Vanessa Guyon's disappearance and murder, they were co-workers, and he was accused of sexual harassment on the base. So he had a bit of a reputation for being a little bit of a creep. So the next day, his girlfriend, who was married to a soldier, so she was uh, obviously in the military community and the military family, but was also Robinson's girlfriend. So she was arrested and charged for assisting him in the mutilation and disposal of her body. So she was charged federally with tampering with evidence. Oh, I should point out, she was found guilty and um, convicted of one count of accessory to murder after the fact, which is the ATF there, and three counts of false statements. Again, when they brought her in, if her mouth was open, she was lying. So it really stalled the investigation for quite a while. And she got, because Robinson took his own life upon apprehension, she was sentenced to 30 years in prison, which she is currently serving. When she was answering questions and they were picking in, trying to see what the truth, of her statements was, um, she, how did you get involved or whatever? And she was like, well, my boyfriend, whenever Robinson bragged to her that he killed a female soldier after hitting her on the head with his work hammer. Then she told investigators that he convinced her to help him take it from there, essentially. Um, a lot of lives wrapped up in that particular scenario. But interestingly, when she was asked the motive behind the murder, um, oh, yep, that's right, Aguilar, sorry. God. She told authorities that uh, Specialist Robinson did it because um, Gideon saw a photo of her, Aguilar, on his phone, and he snapped. Now, the reason behind that, from what the court interpreted, decided, whatever, was um, he was worried about getting in trouble for violating the Army's policy on fraternization rules. Okay. And since Aguilar was still married to the other soldier, they are on the base, even they were separated but still married. Um, he apparently snapped, and for whatever reason thought that she would report him or have a problem with it or whatever the situation was. We'll never know. But yeah, took his work hammer uh, and brutally killed her, and then defiled her body. So with him committing suicide, at least Aguilar got 30 years in prison for being the accomplice. All right. Whew, some good news from that, though. You know, I watched a lot of press conferences with Vanessa Gudion's family, her sisters, her aunties, her mom, and all that. And they made a lot of really positive noise when the ball started rolling. And after widespread calls for justice, a new law was actually added. So that's for protections for survivors of sexual violence. So the act criminalizes sexual harassment now under the UCMJ, or the what's it called? The Uniform Code of Military Justice. It had never been before. Um, the point being with that is that she had told multiple people. She had told um, her coworkers, her family, her friends. Let me see if I wrote. Did I put that? Yeah, yeah. She told them all about it. I thought I put that in there. Um, it also improves how certain officials respond to sex-related offenses. So now it's um, independent investigations within 72 hours of the allegations being made and, of course, reported. So now it's a time limit. They can't put it on the back burner. They have to jump on it while the evidence is hot. Just makes sense. It also removes the decision to prosecute sexual misconduct from the service member's chain of command. So again, um, that actually helps in MST, I think, multiple perpetration, because now you've got an independent panel taking care of the sexual misconduct claim. So it also creates a mechanism to track the allegations of retaliation, which is actually another one of the things um, that I could literally build an entire um, PowerPoint presentation on, is sexual trauma as a result of retaliation. That is getting a lot of looks, shall we say, in the research community right now. So, but anyway, so there's more oversight. There's a lot more accountability. There's more tracking, and also, after she was unfortunately murdered in 2020, the Fort Hood Independent Review Committee was born, and it reviewed issues of climate, culture, safety. Um, Again, like what I said earlier, that in itself is just incredibly interesting. There's a lot of new research around it. Um, how, the culture climate and safety of military bases. Now, of course, they were looking at Fort Hood, but they checked it out, made a lot of recommendations to improve criminal investigation, personnel accountability, victim assistance, and climate and culture. Not, again, like I said, not only at Fort Hood, but within the entire Army. So the family would say a lot in these press conferences, she didn't die in vain. Um, an awful lot came out of her death, as a result of her death, I should say. Um, so yeah, the Army took it seriously. The leadership accepted those recommendations from the Fort Hood Independent Review Committee, and they're implementing the recommendations of the committee. So good on her. Whew, I don't know about you guys, but I need goats and jammies. Just for a sec. Just gotta shake that off for a second. Alright, maybe get a little sip while we watch. Oh, yeah. Yep. There you go. There you go. For those of you that have a different taste in things that calm you down and make you happy, I give you baby pigs and tiny horses. So let's just relax for a second. It's been about a half an hour, exactly as I'd planned, oddly. Um, all right. There we go. All right. I have a bit of a different flavor, just right quick. Ah, as good as baby pigs. I do want to point out that is my tricked out bass boat. I do not have it, but it is my dream bass boat, and I would like very much to have it. And honestly, any of the cars will do. Um, I'm probably more into the yellow one at this point, but no matter what. Ah, pigs and bass boats. All right. All right. Let's talk about the prevalence of military sexual trauma. A couple of quotes here. Sexual assault and sexual harassment remain persistent and corrosive problems, the DoD. And the VA says it's unfortunately common. Thing is, silence. Um, lower rates. So I didn't even say that right. So with silence, there's lower rates represented in data of what the real numbers are. It's important to keep in mind that these data speak only to the rate of MST among veterans who have chosen to seek VA healthcare. They cannot be used to make an estimate, or not just VA healthcare, but DoD, everything like that. It's just kind of saying that an estimate of the actual rates of sexual assault and harassment experiences among all individuals serving in the military. Again, there's a lot more disclosure, which we'll talk about here in a little bit, but relative to the problem, we've got to break the silence. So I dug through some statistics, which I love, data. 10 years of the DoD sex, I can't remember what it's called. Rats. The SAPRO, rats. Anyway, it's in the references. So as we see, total reports of sexual assault Not going to read through all of this. Like I said, you have access to the PowerPoint if you so choose. But I just wanted to point out that in a matter of 10 years, and again, there's a ton of reasons for that I'll briefly go over, but um, this is a combination, or these numbers are a combination of um, all of the reports, the restricted and the unrestricted. Now, as you might imagine, the restricted reports are ones that are confidential and could possibly remain confidential throughout the life of the case. The unrestricted reports are ones where it's not confidential. There, that's about the easiest way to say it. But I just wanted to point out, looking at these numbers, I mean, clearly it's a huge increase in the 10 years there. Between 2012 and 2022, there are 4,550 more reports of sexual assault. That is huge in 10 years. Now, obviously, again, it's the awareness and encouragement to report, uh, a lessening of stigma to some extent, but those numbers are incredible. I am not going to go through this in grave detail, so don't worry about that. I I knocked this into pieces here in um, the following slides, but I just wanted you guys to see the last year that they did this much of a detail. The Department of Defense, their annual report on sexual assault in the military was 2018. Now they probably will provide another, basically just a really cool fact sheet in a year, possibly two. See, there's the top half there, and it's just looking at the sexual assault prevalence between active duty men and active duty women, and it goes a lot further. Like I said, these reports are extremely extensive, so they don't do them every year. But more service members are coming forward to make a report after experiencing a sexual assault. And so about 1 out of 14 men in 2016, or no, I think it's just that's in general. 1 in 14 in 2006, and then about 1 out of 3 in 2018. So that's good. Again, I'm not going to go through all the statistics. You'll have this in the PowerPoint, but it just breaks it down between the Army, Navy, Marines, and the Air Force, looking at 2016 and 2018 numbers. And actually, the DoD, I know this, they do this report every other year, but I don't know if it's as extensive. Whatever. All right. So, uh, of female service members who indicated an experience of sexual assault and reported it. About 21% endorsed experiences consistent with legal criteria for retaliatory behavior. Sexual harassment rates in the military, 6.3% men and 24.2% women, which um, not at all surprised at the difference there. But this was interesting too. They went so far as to say if you did report or reach out after being assaulted or harassed, what was your satisfaction like with your response? And this is actually really, really positive, especially for somebody studying to be an LPC working with military and emergency responders. Um, the fact that they were 70%, 76% satisfied with the support from the victim advocate, 74% satisfied with support from special victims counsel, victims legal counsel, and even 72% satisfied with support from the sexual assault response coordinator. There's only one way they can have a reaction to response. So that's really, 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 really good. you know, it's hugely disruptive to have a lot of sexual misconduct going on military bases, obviously. And they found, the Department of Defense found that sexual harassment, actually, not even assault, well, let me just read it. Sexual assault is a leading factor affecting the unit climate on sexual assault. No, sexual harass, yes, that's what I said. Sorry, I'm getting very tired. Sexual harassment is a leading factor affecting the unit climate on sexual assault. And of course, they control for different variables. So 1 in 5 women, 1 in 12 men, and then this is kind of weird. Bystander intervention. I'm not gonna go through that. You're gonna go ahead. You'll have that. I also looked at sexual assault and sexual harassment at the military academies. And again, this is the DoD data looking at um, academic program year 2017 to 2018 in the military academies. So interesting and transparent. I mean, I love research, but sometimes it can be a real pain in the rump. So the fact that the DoD and the VA really just they put a lot of data out there, they do a lot of research, um, and of course, somebody like me as a student, graduate student, it's like, thank you very much. Anywho, so sexual assault and sexual harassment at the military service academies. So they're talking about, let's see, the three academies enroll about 12,900 students annually, and 16% of men indicated experiencing sexual harassment, and 50% of 3,200 people are, gosh, ah, I got a loose tooth, so I'm like, it's bothering me. Anyway, out of the 3,200 women, 50% indicated experiencing sexual harassment. That's incredible. Um, of the 9,700 men, 2% indicated experiencing unwanted sexual contact. And then 16 of the 3,200 women also reported the same thing. There were 747 students who indicated experiencing unwanted sexual contact. 92 of those reported that to DoD. Very small percentage. Um, in my opinion, I should say. I think statistically it wouldn't technically be that low, but um, just off the cuff, it seems really low. Anyway, they're talking about the United States Military Academy, the Naval Academy, and the Air Force Academy, which is about 45 minutes away south from me, where I'm at right now. Um, but yeah, they look at the data for 2016 and 2018 regarding unwanted sexual contact, of which is, of course, part of MST. But again, you will have these. Cap Cadet and Midshipman Survey results. Okay, so they're talking about intervention. 80% of cadets believe that leaders are trying to stop the problem, and 56% believe peer leaders are making honest and reasonable efforts to stop sexual assault and sexual harassment, which I think those are pretty good numbers, pretty positive. And 63% of women describe their events involving alcohol, and 56% of men describe their MST events involving alcohol. So, not particularly surprised by that. No, no, that sounds about right. I was thinking it may look a little bit higher, but no, that looks about right. And let's see, 12% overall sexual assault reporting rate. Um, you know, 18% of estimated cadets who indicated unwanted sexual contact, 18%, and then 9% of midshipmen. and 10% of cadets. So they're reporting, which is wonderful, but it's still a little low. The VA's data is very, very short and sweet. Um, and I think we'd actually gone over it a little bit, but wanted to present it here with their great symbol. Um, in 2022, 1 in 3 women and 1 in 50 men reported experiencing MST at some point during their military service. So they may or may not have reported it, but that's so 1 in 3 women and 1 in 50 men. I've seen um, other estimates of like 1 in 25 men, but this official VA data from 2020 says 1 in 50 men. So I was curious. So I wanted to see where most of the MST took place within the military. And coming to find out, the high risk installations for women, you can see it here. We've talked about Fort Hood, um, which I'll tell you a little bit about that here in a sec. But it's in Korea. And I want to just bip over to the next one. For men, it's the same. 20th ASG Tagu, Korea, for men and for women. So these are the high risk installations for women: Fort Bliss, Campbell, Carson, Drum, Hood, so on and so forth. My Fort Riley, there by the university. But yeah, and I did want to point out, well, I'll point it out here. So again, we're seeing the same ones, a little bit different for men except for the one on the top, but Fort Bliss, Bragg, Campbell, Drum, and Hood. Now, that fine gentleman that you see there is Major General Edward Cavazos. Fort Hood is no longer called Fort Hood. They changed it to, it's now Fort Cavazos. He was a veteran of the Korean and Vietnam Wars and the very first Hispanic 4-star general in the Army ever. So, I wanted to give him some props. Showing his picture there. He did unfortunately pass away in 2017. But yes, Fort Hood is no longer Fort Hood. It was originally named after a Confederate commander of, I'm not sure exactly where, but uh, they wanted to honor Major General Cavazos. So good on him. All right. Now, obviously, there's a lot of negative impacts when it comes to military sexual trauma, but um, not everybody's going to react the same. I guess essentially is what I want to say. There are a lot of commonalities. Men and women don't react the same. Two women wouldn't react the same. Two men wouldn't react the same necessarily, but there will be some similarities. Um, it's life changing. Like any other form of trauma, any other, particularly sexual trauma, it can be life changing. Um, Veteran survivors have and display a variety of reactions and response, which can depend on a variety of things. I just picked out a few. So, again, whether they have experienced other traumatic events, um, whether the MST happened once, was it repeated? Um, was it an individual? Was it a gang? Um, a combination, like all of these things. And then the types of responses that the survivors received from others at the time of the MST. Um, yeah, absolutely. You get to the point where you want to say something, um, you say it, and you either get a negative reaction, no reaction, blank face, whatever. But that's the negative impact. The other thing is to consider whether they possess certain cultural variables, and we went over that regarding the, shall we say, the most susceptible to MST victimization. So, cultural variables such as gender identity, sexual orientation, race, ethnicity, and religion, according to the VA. Of course, it's strongly related with mental health problems, substance abuse issues, physical health problems, post-military readjustment, post-traumatic stress disorder, depressive and anxiety disorders, personality disorders. Um, PTSD is one of the most common mental health disorders or diagnoses among MST survivors, though they do know that. Dissociative disorders, substance use disorders, which I hit on just a tiny bit, eating disorders, and suicidality. Of course, normally tied to depressive disorders, PTSD, sometimes personality disorders, but generally suicidality um, is a negative impact of MST. Now, survivors have difficulties with attachment to others, maintaining those close and intimate relationships, and overcoming self blame that is inaccurate. Victims, survivors, aren't to blame themselves, but all too many times they do. And of course, it's inaccurate, it's very damaging, and super, super negative in impact. It also messes with people's personal identity, feelings of safety. Um, they isolate from other people, and and of course, you're going to see that in PTSD and depression and sometimes anxiety. But that's what the research is saying. Like, we're seeing um, isolation and using drugs and alcohol to numb those feelings, people not reaching out, not talking. Um, Another topic would be suicide as a reaction to MST or any sexual trauma, really. But um, yeah, too widespread. Survivors have difficulty being, maintaining, staying chill, anger. They're irritable. A lot of other strong emotions are going on with them. They're experiencing self-doubt. Their self-esteem has decreased, and they have a hard time sleeping. Now, of course, sometimes that can be attributed to nightmares. Those nightmares being attributed to PTSD, most likely. Um, the recurrent thoughts and the re-experiencing and whatnot, not being able to sleep, stuff like that. Of course, this is all going on, and your attention, your memory, your concentration, that's going out the window. And again, like not any trauma response, but generally with trauma response, things that remind the survivor of their traumatic experience or experiences of sexual trauma. Um, they also have difficulty with chronic pain, weight management, eating problems, a whole variety of different eating disorders, um, and ultimately gastrointestinal problems. There's quite a lot of research on well, of course, military sexual trauma. It's in the name, but uniquely profound in the military. They're victimized by brothers or sisters in arms, right? They don't expect that. Depend on for safety and protection and other basic needs. So that bond is ruptured and the sense of trust is gone. It challenges the survivors, um, I guess, willingness for future dependency on anyone. And it contradicts military values and ideals of strength, self-sufficiency, um, positive identity, cohesion, solidarity, support. We can go on. Loyalty, teamwork, trust in your comrades, and this one is a big one. suppression of individual needs for the greater good of the unit. This is a uniquely profound contradiction to the military values and ideals, that this behavior contradicts that it's not about the individual, it's about the unit, it's about the team, and this just MST just violates all of that. Tension between the perpetrator and survivor. That's hard to imagine being in that spot with you're you're still working, you're still living with them many times, or in proximation anyway, living and working closely in the same environment with your perpetrator. Um, Leads to feeling betrayed. There's powerlessness, helplessness, um, chronic stress and fear starts to develop, and survivors are at increased risk of further victimization. We keep saying that. Um, being a victim, being a survivor begets being a victim and being a survivor, unfortunately. The other thing too is, you know, sometimes the perpetrators of MST are our supervisors, or they have the power to make decisions about work-related evaluations, promotions, just different opportunities that an MST survivor may want to take a part in. They may bypass those opportunities, request a transfer out of an assignment that they really enjoy, and just for protective avoidance. That's a term that I use. It's pretty self-explanatory, but they'd rather using protective avoidance means, I'm out of here before things get worse. I'll pick up the pieces later. There's, always going to be that unwillingness to disclose their personal experiences. I think this is a pretty powerful graphic. Some survivors remain under the threat of their perpetrators. They remain under their command, um, ultimately under their control, um, at the whim of their decisions in many cases. So, you know, a lot of times they're not going to say anything. That's negatively impactful, if their perpetrators are still giving them, a hard time, still victimizing them. The probability survivors will seek professional mental health services is lowered. That's a huge negative impact of military sexual trauma. Um, we'll get into this just a tiny bit, but there's a lot of shame, fear, and guilt, and again, feelings of betrayal, and everything that the armed forces is supposed to represent and enhance has been torn away in the event of MST. Just briefly, let's talk about some impacts on the family system. Survivors have difficulty with relational functioning, which can have a negative impact on the family system. Makes sense? Survivors may struggle with a sense of safety and trust in others and find it more manageable to isolate themselves from their support system. So that's when you're going to see, um, if they can bear it, the long motorcycle rides, or um, taking off to camp. Well, I live in Colorado, so these are probably kind of Colorado centric, but taking off to go camping, or um, just anything on a whim, just to get away from it all. Um, but that's contradictory of how the family system could successfully function. They come back and have a difficulty adjusting to romantic relationships, sexual, intimate relationships. Um, that's beyond the scope, obviously, of this presentation. But again, another PowerPoint is um, the reaction or the negative impact that MST has on not only the survivors but the people that love them. I think that's really important that the branches of the armed forces really pick up on that, that it is can be systemic. Survivors are more likely to report when returning from deployment. This was a very interesting finding that the MST interfered with their desire to have children. Um, I'm sure there's a ton more research behind that, but yeah, I found that really, really interesting. All right, partners of survivors, they describe that they don't understand and that not understanding MST, um, that they don't know how to provide support, appropriate, timely, non-invasive, like whatever, they just don't know. So they have apprehension about discussing the event with their partner, possibly waiting for their partner to open up about it, but um, maybe even glazing the surface. But then they're left, um, not knowing what, why, how, where, when, who, like nothing. And I think being consistently worried about their partner. So anyway, they also tend to maybe even feel like a failure that they were unable to protect their partner from experiencing a traumatic event. Um, I think a lot of us go through that, if I was there, woulda, coulda, shoulda kind of things, but partners really take that to heart. Um, I don't want to be gender specific about that at all, saying, you know, men are more protective and women. No, I'm an extremely protective woman, of other men or of other women, of men, of people I care about. So, yeah, that feeling of not being able to protect um, someone in a vulnerable position, somebody that you love so desperately and deeply, that can really impact the relationship. Men are going to have a different experience than women, of course. None of this PowerPoint was supposed to be generalized toward women or men or whatever, but there are a few portions where I want to pull out specifics, specific detail and information data for men. In this case, this this researcher and his team kind of made more sense of it all. We look at these numbers, 1 in 3 women, 1 in 50 men, so on and so forth, but that's all relative. And so I thought I'd put this quote here. While the proportion of women who experience MST is greater than men, the absolute number of men who experience MST is similar due to the larger percentage of men in the military. In other words, it's relative. But what that also means, before I move on, what that also means is um, I think more men than we comprehend are victims of MST. I think any kind of sexual trauma, the we think of a woman identifying person first, and then a male identifying person way down the line as far as risk of victimization, but not for MST, and certainly not in the military. And we saw that those installations of high rates of MST. Um, well, there were two columns for the men, I'll put it that way, and the women's list was extremely lengthy and um, had a lot of the same bases on there, so tons more opportunities for research. Men may suffer from gender-based distress that poses unique treatment challenges. I thought this was very interesting. They have a higher probability of opioid use disorder, almost twice the probability of a woman survivor as opposed to a male survivor, opioid use disorder. So I find that very interesting. Someone who's learning more about SUDs or substance use disorders right now, it's pretty interesting. Um, They also may be concerned about their loss of masculinity, particularly if they were, let's say, they're a cisgender male identifying. That's kind of redundant, but heterosexual man, and they suffer sexual violence or harassment or assault by another man in the military, another soldier, another airman, another midshipman, whatever it may be, and some of the guys start to question their masculinity. Some may also question their sexual orientation, and others may be confused about their gender role expectations um, as victims of sexual crimes. They may not pursue treatment due to feelings of self blame and sensitivity to reactions of their providers. That's pretty common across the board with men and mental health, being reluctant to disclose certain things to their providers. Um, there's also, I actually ran into quite a lot of um, research regarding um, shame and a man's need to harbor the MST as a secret, not ever possibly disclosing their experience to their providers, or not in its entirety or in intensity or both. So it's always kind of, if he does choose to say something to his provider, it may not be the whole story. And a lot of times without the whole story, we as providers can't help as much as we would like to. All right, on the downslope. All right, so let's talk about the DoD, or the Department of Defense, and the VA, or the Veterans Administration, taking MST seriously. Um, there's a lot going on. Again, a whole different presentation, a whole separate presentation, but um, just a couple of things I wanted to point out. Veterans don't need to discuss or disclose their MST experience when registering with the VA. Vets can meet with a VA healthcare professional for a clinical evaluation, and then they go from there. That's all the veteran has to do, is just ask to meet with a VA healthcare pro and ask for a clinical evaluation, and then once they get in there, discuss their health concerns with their provider, and then all of their necessary MST related mental health referrals and medical care referrals and stuff can be made at that point. Certainly an advantage of opening up to your provider. MST related services are available at any VA healthcare facility for individuals with veteran status, and this is important, and most former service members with an other than honorable or uncharacterized discharge. This this is huge. I'm not sure that everybody realizes how big this is. Like, if you're in a lot of cases, if you're dishonorably discharged from the military, you're a done deal. But when they were, you know, making all of this, I mean, ultimately, like legislation and stuff around MST, they were like, wait a minute, if a lot of the reason why people like were unsuccessful in the military, or had different issues in the military, stemmed from, a sexually traumatic event during their military service, we probably should take care of that. So say somebody goes off the rails completely, starts drinking, sneaking in drugs, doing all kinds of things to, like, say, manage their manage the trauma from the MST. Um, I just totally forgot what I was saying. Rats. Ah, happens all too often. Hang on, I talk too much. Anyway, um, the point is, a lot of times, um, folks that are don't have like an honorable discharge or other than honorable don't get benefits from the VA, not medical, not dental, not mental health, nothing. They just don't, except if they have MST. Treatment for any physical or mental health condition related to MST is absolutely free of charge from any VA in the country, and that's regardless of when the MST occurred. So, proof of the DoD and the VA taking MST seriously. Every VA healthcare facility has an MST coordinator. I personally know several in my area, which is great. Um, they serve as a contact person for the MST related issues, whether that be referrals, um, benefit assistance related to that, any of that. And of course, with assessing, accessing care. One of my favorites, always, always. I love peer specialists and especially lend me some veteran peer specialists. I work with a couple really fantastic ones. Many of the VA clinics offer the support of professionally trained and certified. They have to go through a program, which I actually do have an extremely long PowerPoint on. Um, Peer support specialists who are part of an individual's treatment team. So that includes um, um, their the person who's doing individual psychotherapy with them, their group therapists, say if they're doing a group DBT or CBT, they're all part of the same treatment team. So it's a group effort at that point to take care of that veteran. Then, of course, if there's individuals that need more support, there's mental health treatment, residential or inpatient. There's quite a bit of that available actually in my area. Individuals can request a clinician of a particular gender, of course, if it helps them feel more comfortable. And mental health services include psychological assessment and evaluation, medication eval and treatment, and individual and group psychotherapy, like we were just talking about. Again, I'm not going to go over this because I see I'm at an hour and 12 minutes at this point, but this is just a timeline of how the Secretary of Defense is um, taking. It's another. I can't even speak. It's like this is a timeline of what they have done to respond to the high prevalence rates of MST throughout the military, all branches, all over the world, actually, as we just saw. Um, but again, this will be in the PowerPoint if you'd like it. All right. So again, I'm not going to go through all of this. There's tons of information out there about all of these different um, the recommended treatment for MST. It's all evidence based for the VA and the DoD. Prolonged exposures for PTSD. Oh, that's my kitty. That was weird. Um, Helps clients with PTSD gradually approach and address traumatic memories, feelings, and situations. And as you're going to see, a lot of these are trauma focused. Makes sense. By confronting these challenges directly, clients may see PTSD symptoms begin to decrease, which is great. One of my favorites, cognitive processing therapy, or CPT, helps clients with a diagnosis of PTSD to identify how traumatic experiences have affected their thinking, to evaluate those thoughts, and to change them. Very good. Through CPT, clients may develop more healthy and balanced beliefs about themselves, others, and the world, which is actually a lot of the reason why I enjoy it so much. EMDR, fascinating, wonderful, very productive, very successful, very effective. This is when they're calling trauma to mind, paying attention to back and forth movement or sound. You could be tapping on your shoulders, you could tap on your, say, thighs or whatever, or the therapist can do this. There's a light bar, all kinds of really cool stuff. I could not even start to begin how the memory gets transferred into another part of the brain through these processes. It's absolutely fascinating, and everybody that takes part in it that I've had contact with has nothing but positive things to say about EMDR. CBT, love this one too, cognitive behavioral therapy. Um, Structured time limited, always good with veterans and service members that experience depression, anxiety, substance use disorders, or other mental health difficulties. So it's really wide ranging in its application. And I love this one in particular because of the behavioral activation component. It just basically says if you're not doing the things that you used to enjoy, like hiking or whatever, go hike. It will make you feel better. So that's the short and the long of that one. Interpersonal therapy, again, this is to build social skills for people that have a really hard time with relationship issues. ACT, a lot of us are familiar with acceptance and commitment therapy. Again, it just helps overcome emotional pain by promoting positive actions and choices that align with their values. And clients may improve their ability to recognize and achieve what truly matters most to them in their life. MET for SUDS. DBT, used quite a lot. I like DBT because it's complex, but it's also got a comforting simplicity to it. Clients address stress and strong emotions. Mindfulness is really big. Distress tolerance is big, and then developing and practicing new interpersonal skills, which is good for us all. All right, again, I see the time is getting long, so one of the other areas where I want to kind of break out the treatment for men is this Yalom 2022 study where they used they drew upon theory about sexual trauma and moral injury and integrated several therapeutic modalities to target and challenge behavioral and cognitive symptoms of shame and thwarted belongingness that are conceptualized to underlie MST related psychological distress. Um, that's a mouthful. But this is really using that multimodal, um, multimodal group for men, looking at all these different like procedures and stuff like that, and it being successful is pretty fantastic. So they're using mindfulness and getting psychoeducation and using square breathing and all, different coping methods and stuff like that. And then they ask folks in this group different questions such as, I think I got, yeah, like, how has your intimacy been difficult? And how is this group prompting it through honest discussion? So it's talking about deeper things, um, just super, super interesting. This particular group modality was a 12-week, 90-minute closed group. The first three sessions were fostering group trust and cohesion. And then, kind of like what I said before, each group session was structured. Mindfulness, then an open group session of the theme pertaining to that MST recovery that we talked about. Invitation for the members to discuss their event, followed by the group discussion for, um, compassion and feedback and so on and so forth. And then they do that DBT coping skill practice, which it looks like the box breathing is kind of the go-to there for that. So just super, super interesting that they they made an MST group treatment for men. So I wanted to point that out. Alrighty. Well, we're almost to the end. I thank you so much for your time, but I do want to go through a few last things. And again, you're going to have all these on the PowerPoint, but there's resources specifically for MST survivors recommended by the VA. Some more there. Resources, applications, most online things, 24/7 services. Now this is an MST fact sheet. It's usually a 3-page document. I broke it up to make it bigger so you guys could see it, but I also have it available in, well, you can find it in the references or you can easily find this online, but this is really great. I love that a lot of the, it's everything we talked about, obviously, but it's in 3 pages. And it's a great three, 3-page fact sheet, really, ultimately. Yeah, really, really nice. But again, I have all 3 pages in their entirety if you should want them. Or again, they're accessible online. All right, just real quick. I thought this was pretty cool. Applications for military families. These are 4 of the best ones that military.com came up with. The military.com transition app, the WhatsApp, the Sesame Street for military families. Love that. And Sandbox. And that's only for military people, so that's pretty cool. All right. To end this off, I want to just talk about, well, to show you some graphics really, about some campaigns that are going on, current campaigns around sexual assault and sexual harassment and violence. Um, so, yeah, this is the Army. I'm loving their color scheme. A culture of support. Good stuff. I love it. These are 2 of their flyers. So, their thing now is the sexual assault, sexual harassment, not in our Army. And then they've got this together, this will defend. And this one's cool too. I love how this one shows what seems like a civilian, obviously an officer, and an enlisted, a soldier. I love this one. It says so much. Also, Army, I am the force behind the fight. I am committed to stopping sexual harassment and sexual assault. I am living the Army values. I am protecting the members of my team. So, the Army's got some pretty great campaign there. All right, Air Force. So there's this take action against sexual assault. Stop means stop. Stop it if you see it and listen to the victim. So that's really great. Oh, no, this is Marines. Sorry. This is Marines. Now, this is the Marine campaign for men. Courage to report fuels change. I think that's cool. The Navy. So they've got, let's see, this is actually pretty cool. Let's see, her set, or the 2 on the left say, so when she told me that guy went way too far with her, I said, let's call Savvy. So that's their 24/7 helpline. And then his in the middle says, so when I saw she was drunk, I told my shipmate, ask her when she's sober. Love that. And then, so when that guy tried to cross the line with my shipmate, I got her out of there. Awesome. So standing up against sexual assault is part of my duty. My strength is for defending, is the Navy. I like this one too because it's just really representative. Different warriors there. Air Force. I like this one. I thought it was cute with the their little ribbon on there. But yeah, zero tolerance for sexual assault is Air Force. Now this is the Sapper, but this one is the color scheme and everything is specific to the Air Force. So I thought that was pretty nice. Loving this. Don't let it happen. Be a wingman. And then let's see, sexual assault hurts one, affects all. Great, great graphics. Love it. Love the messages. Even the National Guard is in on it. Sexual assault prevention and response. Sapper. All right. Tons of resources. Feel free to access. Thank you so much for watching the presentation. I know it was lengthy. We're at about an hour and 25 minutes, but I wanted to make sure and get all this in. And I feel like I did. I hope you guys learned something. And I super, super, super appreciate it. And thank you, Yankee. Take care, everybody.